back to another video of Pearls of Medical Nutrition. And today's video is about a very important topic, that is common signs and symptoms of cancer. So let's get started. No matter your age or health, it's good to know the possible signs of cancer. By themselves, they aren't enough to diagnose the disease, but there can be clues for you and your doctor so that you can find and treat the problem as soon as possible. Treatment works best early on, when a tumor is small and hasn't spread. These symptoms don't always mean cancer. Lots of common conditions can make you feel this way. It's important to see your doctor so they can take a closer look at your health and take action. Common signs and symptoms of cancer in both men and women include pain. Bone cancer often hurts from beginning. Some brain tumors cause headaches that last for days and don't get better with treatment. Pain can also be a late sign of cancer, so see a doctor if you don't know why it's happening or it doesn't go away. Weight loss without trying. Almost half of people who have cancer lose weight. It's often one of the signs that they notice first. Fatigue. If you're tired all the time and rest doesn't help, tell your doctor. Leukemia often wears you out, or you could have blood loss from colon or stomach cancer. Cancer related weight loss can leave you exhausted too. Fever. If it's high or lasts more than 3 days, call your doctor. Some blood cancers, like lymphoma, cause a fever for days or even weeks. Changes in your skin. Have your doctor looked at unusual or new moles, bumps, or marks on your body to be sure skin cancer isn't lurking? Your skin can also provide clues to other kinds of cancers. If it's darkened, looks yellow or red, it itches or sprouts more hair, or if you have an unexplained rash, it could be a sign of liver, ovarian, or kidney cancer or lymphoma. Sores that don't heal, spots that bleed and won't go away are all the signs of skin cancer. Oral cancer can start as sores in your mouth. If you smoke, chew tobacco, or drink a lot of alcohol, you're at higher risk. Cough or hoarseness that doesn't go away. A cough is one sign of lung cancer, and hoarseness may mean cancer of your voice box, larynx, or thyroid gland. Unusual bleeding. Cancer can make blood show up where it shouldn't be. Blood in your poop is a symptom of colon or rectal cancer, and tumors along your urinary tract can cause blood in your urine. Anemia. This is when your body doesn't have enough red blood cells, which are made in your bone marrow. Cancers like leukemia, lymphoma, and multiple myeloma can damage your marrow. Dietary tips. Eating too much of certain foods may increase cancer risk. It's difficult to prove that certain foods cause cancer. However, observational studies have repeatedly indicated that high consumption of certain foods may increase the likelihood of developing cancer. Likelihood of developing cancer. Sugar and refined carbs. Processed foods that are high in sugar and low in fiber and nutrients have been linked to a higher cancer risk. In particular, researchers have found that a diet that causes blood glucose levels to spike is associated with an increased risk of several cancers, including stomach, breast, and colorectal cancers. Insulin has been shown to stimulate cell division, supporting the growth and spread of cancer cells and making them more difficult to eliminate. In addition, higher levels of insulin and blood glucose can contribute to inflammation in your body. In the long term, this can lead to the growth of abnormal cells and possibly contribute to cancer. This may be why people with diabetes, a condition characterized by high blood glucose and low insulin levels, have an increased risk of certain types of cancer. To protect against cancer, limit or avoid foods that boost insulin levels, such as foods high in sugar and refined carbs. Processed meat. Processed meat refers to meat that has been treated to preserve flavor by undergoing salting, curing, or smoking. It includes hot dogs, ham, bacon, chorizo, salami, and some deli meats. Observational studies have found an association between consuming processed meat and an increased cancer risk, particularly colorectal cancer. Several reviews that combined results from multiple studies found that the evidence linking unprocessed red meat to cancer is weak and inconsistent. Overcooked food. Cooking certain foods at high temperature, such as grilling, frying, sauteing, broiling, and barbecuing, can produce harmful compounds like heterocyclic amines and advanced glycation end products. Excess buildup of these harmful compounds can contribute to inflammation and may play a role in the development of cancer and other diseases. Certain foods, such as animal foods high in fat and protein, as well as highly processed foods, are most likely to produce these harmful compounds when subjected to high temperatures. These include meat, particularly red meat, certain cheeses, fried eggs, butter, margarine, cream cheese, mayonnaise, oils, and nuts. To minimize cancer risk, avoid burning food and choose gentler cooking methods, especially when cooking meat, such as steaming, stewing, or boiling. Marinating food can also help. Dairy. Several observational studies have indicated that high dairy consumption may increase the risk of prostate cancer. Theories suggest that these findings are due to an increased intake of calcium, insulin like growth factor 1, or estrogen hormones from pregnant cows, all of which have been weakly linked to prostate cancer. Being overweight or obese is linked to increased cancer risk. Other than smoking and infection, being obese is the single biggest risk factor for cancer worldwide. It increases your risk of 13 different types of cancer, including the esophagus, colon, pancreas, and kidney, as well as breast cancer after menopause. Obesity can increase cancer risk in three key ways. Excess body fat can contribute to insulin resistance. As a result, your cells are unable to take up glucose properly, which encourages them to divide faster. Obese people tend to have higher levels of inflammatory cytokines in their blood, which causes chronic inflammation and encourages cells to divide. Fat cells contribute to increased estrogen levels, which increases the risk of breast and ovarian cancer in postmenopausal women. The good news is that several studies have shown that weight loss among overweight and obese people is likely to reduce cancer risk.